Hi everybody, my name is Alex Cantu, and today I'm going to be going over the second half of the Exam 2 discussion board. For the second half, I decided to touch upon the topic to discuss vascular responses to acute resistance exercise. So with due to the nature of resistance exercise, it is obvious that patients are going to see increases in blood pressure. However, a study that I was able to find regarding this topic wanted to see if it was safe for hypertensive patients to be performing resistance exercise. This study is titled the Intra-Arterial Blood Pressure Response in Hypertensive Subjects During Both Low and High Intensity Resistance Exercise. So within this study, they had 10 hypertensive patients and 10 normotensive patients. And what they did was they evenly split them into both low and high intensity exercise groups. With the high intensity exercise group, they were going to be performing 80% of their 1 rep max on the leg extension machine, and they were going to be testing their blood pressure results both before exercise, during the rest times, and after. Same for the low intensity group. However, they would be doing the exercise at 40% of their 1 rep max. So what they ended up finding was that with the hypertensive patients, they did see a significant increase in systolic blood pressure in comparison to the normotensive patients. So they also ended up seeing an increase in diastolic blood pressure. However, it wasn't as bad. And during their rest periods, the systolic blood pressure did take longer to return back to normal in comparison to normotensive patients. And their diastolic was able to return back to normal. Within the normotensive patients, they found that systolic blood pressure returned to normal fairly quickly within their rest time, and their diastolic actually went below normal. So after seeing these responses to resistance training, they did recommend that patients with hypertension should definitely consult a physician before completing any type of resistance training. So after analyzing the responses to these forms of resistance exercise, they came to the conclusion that it might not be beneficial for hypertensive patients to be completing resistance exercise programs. This is due to both the increases in systolic and diastolic blood pressure, depending on if the patients might have any other underlying health conditions. It might lead to complications such as aneurysms, which is definitely something that hypertensive patients don't want to see. They also did recommend that if they do end up completing resistance exercise, that they should perform it at low intensities with a little bit higher rest time. However, they also did state that more studies should be done in order to validate these recommendations.